It's, of course, now 2 years after the pandemic. And we have seen probably in 3 different ways it has impacted the population and communities. The first is the health. It has, of course, overwhelmed the health system globally, but it has also exposed the inequities that existed already pre-pandemic. The pandemic just exposed that. And it showed the lack of investment in many different parts of the world. And unfortunately, sometimes even in the developed world, we saw the weaknesses. The second aspect has been on the socioeconomic impact it is having on population. Mostly, the people living in the refugee camps or underdeveloped environment, or the people on the move. Of course, it has also disproportionately affected women. Also, the crowded cities have been disproportionately highly affected. So it's having a massive socioeconomic impact right now, but it will have a lingering impact in a long time to come.
You mentioned people living in cities, women, and people who are displaced or refugees. In which way is the pandemic affecting lives for those particular groups?
If I start from the refugees, for example, they are already living on quite crowded conditions with a very basic minimum infrastructure. So pandemic coming on top of that means it absolutely puts their life upside down. They already didn't have access to the basic support. They are living in crowded conditions. The hygienic facilities are generally poor, and the access they have to the support is already very minimum. So COVID coming on top of that makes their life very difficult. On top of that, in a number of countries, there are also political considerations, and because of the politics of the country, the access for them to the service it becomes even more difficult. So they are really disproportionately highly affected.
Would you say that the effects of the pandemic in low-income countries is mostly a crisis which is a health crisis or a crisis, an economic crisis?
I think it's both. Of course, it started as a health crisis, and as we saw how quickly the health systems were overwhelmed. But the long-term impact of the lockdowns, the economic activity is slowing down. And in many countries, as you know, the millions of people depend on daily wages. That's gone. So its impact, economic impact, is massive and severe. And one aspect that's sort of being talked about now, but it needs to be talked about more, is the impact it is having on everybody, but particularly on young populations, on their mental health. So the scar that will be left behind by this crisis on the mental health of the population would unfortunately be very long-lasting.